The tragic case of a 72-year-old man who lost his life after urinating at night has raised pressing questions about the hidden risks elderly individuals face when performing seemingly routine activities. This incident highlights the importance of understanding what happened, why it happened, and what can be done to prevent similar outcomes in the future. By breaking this down, we can provide valuable insights for anyone who cares about the well-being of elderly loved ones or plans for their own aging process. This man's death was not an isolated occurrence, but rather an example of a phenomenon that doctors and health experts have observed in elderly populations. To understand what caused this outcome, it is essential to consider the physiological and situational factors at play. The elderly body undergoes numerous changes that affect everything from blood pressure regulation to balance and muscle strength. In this specific case, doctors believe the man likely experienced a sudden drop in blood pressure, a condition medically known as postural hypotension, which occurs when someone stands up too quickly. For elderly individuals, who often have a less robust cardiovascular system, this drop can lead to dizziness or even fainting, creating a risk of falls or more severe health events. Postural hypotension happens because, as people age, their blood vessels lose elasticity and their heart's ability to pump blood efficiently diminishes. When a person transitions from lying down to standing, gravity causes blood to pool in the lower extremities. In healthy younger adults, the nervous system compensates rapidly by constricting blood vessels and increasing heart rate to maintain blood flow to the brain. However, in older adults, this response is often delayed or insufficient. In the case of the 72-year-old man, it is believed that the act of standing up at night after a period of rest triggered this physiological chain reaction. This likely led to a temporary reduction in blood flow to the brain, causing fainting or collapse, which may have resulted in a fatal injury or cardiac arrest. Adding to the risk, nighttime waking is itself a vulnerable moment for elderly individuals. The natural drop in body temperature and metabolic rate during sleep means that the body is in a state of reduced alertness and responsiveness. Additionally, many elderly people take medications to manage chronic conditions such as high blood pressure or diabetes. These medications can exacerbate the risk of postural hypotension or other complications. For example, diuretics, commonly prescribed for hypertension, increase nighttime urination and can lead to dehydration, further worsening blood pressure regulation. In this case, it is plausible that a combination of medication effects and the physiological stress of standing contributed to the man's tragic outcome. Beyond the immediate physiological risks, environmental factors also play a crucial role. Many elderly individuals live in homes that are not adequately adapted to their needs. In this case, the man's home may not have had proper lighting or grab bars to assist with stability. Darkness or poor visibility at night can increase the likelihood of tripping or falling, especially for someone already experiencing dizziness or imbalance. A fall in the bathroom or on the way to it can result in serious injuries such as head trauma or fractures. For elderly individuals, these injuries often have more severe consequences than they would for younger people due to reduced bone density and slower healing processes. It is important to note that elderly individuals often experience nocturia, a condition characterized by frequent nighttime urination. This condition is common and can be caused by a variety of factors, including an overactive bladder, enlarged prostate, or chronic illnesses such as diabetes and heart failure. While nocturia is not inherently dangerous, it increases the number of times an elderly person must get out of bed at night, multiplying their exposure to potential hazards. In this case, the man's need to urinate may have been a symptom of an underlying condition that contributed to his vulnerability. When examining this incident, it is critical to consider how the presence of underlying health conditions might have compounded the risks. Many elderly individuals live with multiple chronic diseases that interact in complex ways. For example, cardiovascular disease, which is prevalent among older adults, can weaken the heart's ability to pump blood effectively, further increasing the likelihood of postural hypotension. Similarly, conditions such as diabetes can damage the autonomic nervous system, impairing the body's ability to regulate blood pressure and balance. In this case, the man's medical history might have included one or more of these conditions, creating a perfect storm of risk factors. The psychological and behavioral aspects of nighttime waking also cannot be ignored. Elderly individuals who wake up at night may feel disoriented or groggy, affecting their ability to move safely. In some cases, they may try to rush to the bathroom out of fear of incontinence, which can lead to hasty movements and increase the risk of falling. This sense of urgency may have been a factor in the 72-year-old man's case. Rushing without taking the necessary precautions can have devastating consequences, particularly for those with compromised physical abilities. To prevent similar tragedies, it is essential to address the three key areas that doctors emphasize for elderly individuals waking up at night. First, they should focus on ensuring a safe environment. This includes installing night lights to improve visibility, securing loose rugs or objects that could cause tripping, and adding grab bars or railings in critical areas such as near the bed or bathroom. Simple modifications like these can significantly reduce the risk of accidents. Second, elderly individuals and their caregivers should pay close attention to hydration and medication management. Drinking an appropriate amount of water during the day while limiting fluid intake a few hours before bedtime can help reduce the frequency of nighttime urination. At the same time, reviewing medications with a healthcare provider can identify any drugs that might increase the risk of dizziness or falls. Adjustments to dosages or timing can make a significant difference in safety. Third, adopting cautious behavior when getting out of bed is crucial. Doctors recommend taking a moment to sit up on the edge of the bed before standing. This allows the body's cardiovascular system to adjust gradually, reducing the likelihood of a sudden drop in blood pressure. Using assistive devices such as a cane or walker can also provide additional stability. Encouraging elderly individuals to move slowly and deliberately can help mitigate risks. The case of the 72-year-old man serves as a sobering reminder that even routine activities can carry hidden dangers for elderly individuals. By understanding the physiological changes that occur with aging and taking proactive steps to address them, it is possible to reduce these risks significantly. This incident highlights the importance of a holistic approach that considers medical, environmental, and behavioral factors. By doing so, we can help ensure that elderly individuals live safer and healthier lives, even in the face of challenges like nocturia or postural hypotension. The seemingly simple act of getting up at night can pose unexpected challenges for elderly individuals, creating risks that many people overlook. Doctors have identified this routine as a critical moment where safety measures can prevent serious accidents or even save lives. By understanding the risks and implementing practical advice, elderly individuals and their caregivers can ensure greater safety during nighttime awakenings. Through this lens, we can explore the three key recommendations doctors make to address this issue effectively. One of the primary risks associated with getting up at night is postural hypotension, a condition that causes a sudden drop in blood pressure when standing up. This condition can lead to dizziness, fainting, or falls. As people age, their cardiovascular systems often lose some of their efficiency, making it harder for the body to regulate blood flow when transitioning from lying down to standing. Blood pools in the lower extremities due to gravity, and the delayed response from the nervous system can result in a lack of blood flow to the brain. This physiological change increases the chances of falls or loss of balance, particularly in the dark or on slippery surfaces. For elderly individuals, the consequences of a fall can be severe, often leading to fractures, head injuries, or even long-term disability. To counteract this risk, doctors recommend that elderly individuals adopt a gradual and deliberate approach when getting up at night. Rather than rushing out of bed, they should first sit up slowly and remain seated for a minute or two. This pause allows the cardiovascular system to adjust gradually, reducing the likelihood of dizziness or fainting. Additionally, they can perform light ankle or leg movements while sitting to help stimulate circulation before standing. Such small but deliberate actions can significantly lower the risk of postural hypotension and its associated dangers. Another crucial recommendation involves ensuring a safe and well-lit environment. Poor visibility during nighttime movements is a significant factor contributing to accidents. Many elderly individuals live in homes where the lighting is insufficient, particularly in hallways or bathrooms. Tripping hazards such as loose rugs, clutter, or uneven flooring further exacerbate the risks. Doctors emphasize the importance of creating an environment that minimizes these dangers. Installing night lights in bedrooms, hallways, and bathrooms is a simple yet highly effective way to enhance visibility. These lights provide just enough illumination to guide the way without disrupting sleep. Removing tripping hazards is equally important. Elderly individuals and their caregivers should conduct a thorough assessment of the living space to identify potential obstacles. Securing loose rugs with non-slip pads or removing them altogether can eliminate a common source of falls. Similarly, clearing pathways of furniture, cords, or other items ensures a clear route to the bathroom or other destinations. Adding grab bars near the bed, in hallways, or around the bathroom can provide additional support for those who may struggle with balance or strength. These modifications require minimal effort but can make a substantial difference in preventing accidents. Hydration and medication management represent another critical area of focus. Many elderly individuals experience frequent nighttime urination, a condition known as nocturia, which increases the number of times they need to get up at night. While staying hydrated is essential for overall health, excessive fluid intake in the hours leading up to bedtime can contribute to nocturia. Doctors recommend balancing hydration by encouraging elderly individuals to drink sufficient fluids during the day while limiting intake 2 to 3 hours before bedtime. This practice helps reduce the frequency of nighttime awakenings without compromising overall hydration levels. Medications also play a pivotal role in nighttime safety. Many elderly individuals take prescriptions for chronic conditions such as hypertension, diabetes, or insomnia. These medications can have side effects that increase the risk of falls or other complications. For example, diuretics, often prescribed for high blood pressure, can lead to dehydration or nocturia. Sedatives or sleep aids can cause grogginess or disorientation upon waking. Doctors advise regular reviews of medication regimens with a healthcare provider to ensure that the timing and dosages are optimized for safety. Adjusting when certain medications are taken or exploring alternative treatments can mitigate risks while maintaining effectiveness. Behavioral adjustments complement these practical measures by addressing the habits and actions that can inadvertently increase nighttime risks. One common issue is the tendency for elderly individuals to rush when they feel an urgent need to reach the bathroom. This urgency can lead to hurried movements that compromise balance and coordination. Doctors recommend encouraging a calm and steady approach. Taking a few deep breaths before moving and using assistive devices such as a cane or walker can help maintain stability. Incorporating physical activity into daily routines can also improve nighttime safety by enhancing strength, balance, and flexibility. Regular exercise tailored to an individual's capabilities, such as gentle yoga, tai chi, or walking, can strengthen muscles and improve coordination. These benefits translate into greater confidence and stability during nighttime movements. Even simple exercises like ankle circles or leg lifts performed during the day can contribute to better overall mobility. Sleep hygiene is another important consideration. Poor sleep quality can exacerbate nighttime disorientation or grogginess, increasing the likelihood of accidents. Maintaining a consistent sleep schedule, creating a comfortable sleep environment, and addressing conditions such as sleep apnea can improve overall restfulness. For elderly individuals, better sleep often translates into fewer nighttime awakenings and safer transitions when they do occur. The psychological aspects of nighttime safety should not be underestimated. Anxiety or fear about falling can create a self-perpetuating cycle where individuals become hesitant or overly cautious, potentially leading to reduced mobility or independence. Providing reassurance and emphasizing the effectiveness of safety measures can help alleviate these fears. Encouraging open communication about concerns and involving caregivers or family members in creating a safer environment fosters a sense of security and empowerment. In some cases, technological solutions can further enhance safety. Motion-activated lights, bed alarms, or wearable devices that detect falls and alert caregivers can provide additional layers of protection. These tools are particularly valuable for individuals who live alone or have limited mobility. While technology should not replace personal vigilance or preventive measures, it can serve as a valuable complement to existing strategies. The recommendations to stay safe when getting up at night are rooted in understanding the unique challenges of aging and addressing them through practical, actionable steps. By adopting gradual movements, creating a safe environment, and managing hydration and medications effectively, elderly individuals can significantly reduce their risks. These measures are not merely theoretical but are backed by real-life case studies and observations from healthcare professionals. For instance, a study conducted on elderly fall prevention highlighted that homes equipped with adequate lighting and grab bars saw a marked reduction in nighttime accidents. Similarly, participants who practiced slow and deliberate movements when rising from bed reported fewer incidents of dizziness or imbalance. Ultimately, the goal is to empower elderly individuals to maintain their independence and quality of life while minimizing risks. These recommendations are simple yet powerful tools that address the underlying causes of nighttime accidents. By fostering awareness and implementing these strategies, we can create safer environments and instill confidence in elderly individuals and their caregivers. The journey to safer nighttime routines begins with understanding the risks and taking proactive steps to address them. With these practices in place, the act of getting up at night can become a safer and more manageable part of daily life. How can elderly people prevent health complications from nighttime bathroom visits? Preventing health complications from nighttime bathroom visits is a vital concern for elderly individuals. Nighttime trips to the bathroom may seem routine, but they carry specific risks that, if unaddressed, can lead to severe complications. By understanding the underlying challenges and adopting practical measures, elderly individuals can protect their health and maintain their independence. One of the primary concerns during nighttime bathroom visits is the increased risk of falls. As people age, factors like reduced muscle strength, decreased balance, and impaired vision make navigating in the dark particularly hazardous. The first step in addressing this risk is ensuring a well-lit and obstacle-free pathway. Using motion sensor lights that automatically illuminate the route can significantly reduce the chances of tripping. Placing night lights strategically in the bedroom, hallway, and bathroom can further enhance visibility. Additionally, securing loose rugs, removing clutter, and ensuring smooth flooring create a safer environment. Another critical factor to consider is the impact of medications. Many elderly individuals take medications that can cause dizziness or lower blood pressure, especially when transitioning from lying down to standing. This condition, known as orthostatic hypotension, can lead to fainting or falls. To mitigate this risk, individuals should rise from bed slowly, allowing their body time to adjust to the change in position. Sitting on the edge of the bed for a few moments before standing up can help stabilize blood flow and prevent sudden drops in blood pressure. Regularly reviewing medications with a healthcare provider is also essential to identify potential side effects or interactions that may contribute to nighttime complications. Hydration management plays a pivotal role in reducing nighttime bathroom visits while ensuring overall health. While it is crucial to stay hydrated throughout the day, consuming large amounts of fluid close to bedtime can lead to frequent awakenings. Elderly individuals should aim to drink the majority of their fluids earlier in the day and limit intake in the hours leading up to bedtime. This practice can reduce the need for nighttime trips without compromising hydration. Monitoring the types of beverages consumed is equally important. Caffeinated or alcoholic drinks can irritate the bladder and increase nighttime urination. Opting for water or herbal teas during the evening can help minimize disruptions. Bladder health is another area that requires attention. Conditions such as overactive bladder or urinary incontinence are common among the elderly and can contribute to frequent nighttime urination. Engaging in pelvic floor exercises, like Kegels, can strengthen the muscles that control urination and improve bladder control. These exercises are simple to perform and can be incorporated into a daily routine. Consulting a healthcare professional for tailored advice or treatment options, such as medications or physical therapy, can also make a significant difference in managing bladder-related issues. Sleep quality has a profound impact on overall health and nighttime bathroom visits. Poor sleep can exacerbate the frequency of awakenings and contribute to fatigue and reduced alertness. Creating a calming bedtime routine, such as reading, meditating, or listening to soothing music, can promote better sleep. Ensuring a comfortable sleeping environment with appropriate bedding and room temperature further enhances restfulness. For individuals experiencing sleep disorders like insomnia or sleep apnea, seeking medical intervention is essential. Proper management of these conditions can improve both nighttime and daytime well-being. Another important consideration is the role of diet in managing nighttime bathroom visits. Consuming foods that are high in salt or sugar can increase fluid retention and stimulate thirst, leading to greater fluid intake and urination. Maintaining a balanced diet rich in fruits, vegetables, whole grains, and lean proteins supports overall health and minimizes unnecessary fluid buildup. Additionally, keeping a food and drink diary can help identify patterns and triggers that contribute to nighttime disruptions. Physical activity is a key component in promoting health and preventing complications. Regular exercise improves circulation, strengthens muscles, and supports bladder health. Activities such as walking, swimming, or gentle yoga are excellent options for elderly individuals. Staying active also contributes to better sleep quality and overall vitality. However, it is important to avoid vigorous exercise close to bedtime, as this can interfere with the ability to fall asleep. Addressing psychological factors is equally crucial. Anxiety about falling or experiencing a health issue during nighttime bathroom visits can create a cycle of stress and disturbed sleep. Practicing relaxation techniques, such as deep breathing or progressive muscle relaxation, can alleviate anxiety and promote a sense of calm. Talking openly with caregivers or family members about concerns and strategies can also provide reassurance and support. Establishing a reliable system, such as using a medical alert device, can further ease worries by ensuring help is readily available if needed. Footwear and clothing choices are often overlooked but play a significant role in safety. Wearing non-slip socks or sturdy slippers with good traction reduces the risk of slipping on smooth surfaces. Opting for comfortable, easy-to-remove clothing minimizes delays and discomfort during nighttime bathroom visits. These small adjustments can make a substantial difference in the ease and safety of these trips. Chronic health conditions, such as diabetes or cardiovascular issues, can influence nighttime bathroom visits and require careful management. For individuals with diabetes, maintaining stable blood sugar levels through diet, medication, and monitoring is essential to prevent excessive thirst and urination. Similarly, those with heart conditions should follow their doctor's advice regarding fluid intake and medication to reduce strain on the heart and prevent fluid accumulation. Regular checkups and open communication with healthcare providers are critical to addressing these underlying health issues effectively. Environmental modifications can further enhance safety and convenience. Installing grab bars near the toilet and along the pathway to the bathroom provides additional support and stability. Using a raised toilet seat can make it easier for individuals with limited mobility to sit and stand. For those with significant mobility challenges, considering alternatives like bedside commodes or urinals may offer a practical solution. Ensuring that the bathroom is easily accessible and free from hazards creates a secure environment that promotes independence. Recognizing and addressing dehydration is another crucial aspect of nighttime health. While limiting fluid intake before bed is important, it is equally vital to avoid dehydration, which can lead to complications such as urinary tract infections or kidney issues. Paying attention to signs like dry mouth, dark urine, or reduced urination frequency can help identify dehydration early. Balancing hydration throughout the day and consuming electrolyte-rich fluids when necessary can support optimal health. Caregivers and family members play a vital role in preventing nighttime health complications for elderly individuals. Observing changes in behavior, mobility, or bathroom habits can provide valuable insights into potential issues. Encouraging open communication and providing assistance as needed fosters a supportive environment. Offering practical solutions, such as helping with nighttime routines or arranging for professional assessments, ensures that elderly individuals receive the care and resources they need. Proactive planning is an effective strategy for minimizing nighttime disruptions. Establishing a consistent bedtime schedule helps regulate the body's internal clock and reduces the likelihood of waking up unnecessarily. Preparing the environment in advance, such as setting out essentials like a flashlight or keeping water within easy reach, enhances convenience and safety. These measures empower elderly individuals to navigate nighttime challenges with confidence. Monitoring physical and mental health is essential in preventing complications. Symptoms like frequent urination, pain during urination, or sudden changes in bathroom habits should be promptly evaluated by a healthcare provider. Identifying and treating underlying conditions, such as urinary tract infections or prostate issues, prevents escalation and promotes overall health. Similarly, addressing mental health concerns like anxiety or depression contributes to better sleep and fewer nighttime disturbances. Elderly individuals can take an active role in maintaining their health and independence by staying informed and adopting practical measures. Simple adjustments, such as improving lighting, managing fluid intake, and incorporating physical activity, create a foundation for safety and well-being. By working collaboratively with caregivers and healthcare providers, they can overcome challenges and enjoy a higher quality of life. Recognizing the interconnectedness of physical, emotional, and environmental factors is key to preventing health complications from nighttime bathroom visits.